So Sadie, Phil, welcome to the Digital Hub. Thank you for coming today. The Digital Hub is SCC's initiative in innovation in healthcare, where we work with clinicians, we understand problems and opportunities and work together to go and deliver positive outcomes for the UK healthcare system. Phil, would you like just to give us an overview of voice care?
So voice care is a highly configurable, voice-directed digital solution that provides guided workflows for healthcare professionals to support them in the complexity of day-to-day clinical delivery.
This system allows us to have those processes prompted to us to ensure that we continue to follow protocol. It also allows us to have a fully auditable process. It ensures that we can look into the governance of everything that we do.
So Sadie, can you give us a view of your journey with voice care?
At Imperial, which is where I work, we were having issues with our central line insertions, and despite having a checklist, we were leaving wires in or having complications associated with doing that process. So we looked as an innovation lead to something that would help us support the steps associated with the checklist. And Voice Care Solution came to us. And the Voice Care Solution was an algorithm that looked at the checklist but acted outside of just being a tick box exercise to be one that acts as a prompt to the human way of thinking. We were able to really look at where improvement could occur in a complex multi-step process. Checklists are something that are a hierarchy of good patient safety, and they are effective, but the problem right now is that we're using them as a tick box exercise. And for me, having gone through this journey, I've realised that it has massive application throughout our healthcare system. There are hundreds of checklists within our healthcare system, and this could be applied in a standard way to all of those processes. And we can use it for big systems that are used around the world, things like the WHO surgical checklist, which is used in every hospital around the world.
So Sadie, we see voice care as a digital solution that will really make a difference to health outcomes, but also align to those improvement agendas at a local, national and system level. From your perspective, can you explain to us how you see this solution providing benefit in these areas?
The NHS is an organisation that is full of processes and protocols, and they were built to mitigate for human error in order to improve patient safety and clinical outcomes. Voice care is a system that can be used across a multitude of areas clinically to support the staff to deliver the best healthcare we can for our individual patients. We remove some of the resource heaviness associated with audit and governance in healthcare systems because this will do it automatically. And that resource can then be tailored and put somewhere else where it's much more needed, where the human being is a much more important factor than just a data collection set. It also means that we have greater productivity because there's a lot of heavy work associated with patient paperwork. This system prompts us to ensure that we are following due process so that we get the best clinical outcome. And in turn, that gives us cashable savings, and because we're ensuring that we don't have problems associated with clinical care, and we also have the ability to audit those processes in a system that's going to collect that data set continuously as it's being used. It has a sustainability portfolio because ultimately we're collecting data, we're stopping use of paper, and that means that we become a much more resource efficient system. We are allowed to get that data directly into a patient clinical record, which allows us to analyse it appropriately and then inform the greater world of what needs to be done next to improve things for the future, or to change a service for the better, or to change a national process because we recognise where errors and problems are occurring.
Is there a sufficiently trained operator present?
Yes.
Should you require senior or consultant assistance, do you know who the nominated individual is and how you will contact them?
So all of these questions obviously have been pre-configured. we've actually worked with Sadie and the team at Imperial to actually make sure that this is an optimised solution with only that verbiage that we want to express to come out the speaker. Yes.
Is all appropriate monitoring in place?
Yes.
Is all procedural equipment available?
Now you'll notice as well that I'm actually having a conversation and it's not actually knocking the system off its thread. So as you can imagine, in a busy theatre, there's lots of conversations happening and occurring. It's essential that this system does not move on from the appropriate step until you've given the actual confirmation.
Confirm correct placement of the wire.
Confirm. So at this point, with a fully integrated solution, all of the data that's been captured during that process would be uploaded in real time to the patient record.
At its core, it's implemented to mitigate against human error, create that automated and guided process which will really support compliance and auditability whilst ensuring patient safety.